Hi, everybody. Thanks for joining us. This is our third in a series of webinars on exercises medicine. Today, we're going to be discussing how to prevent cardiovascular disease, including the main causes of heart disease and how exercise and lifestyle play an important role in prevention and treatment. So my name is Rebecca Connect. I'll be your host. I'm the lead exercise physiologist for LifeScan Wellness Centers. We're one of the largest and most trusted providers nationally for annual public safety exams. We help to screen for cancer and heart disease in over 40,000 first responders annually. We've been working in concordance with StrongPath, whose mission is to use the best of science and technology to promote optimal health and function at any age by putting the power of health and behavioral changes in everybody's hand. So StrongPath uses a coach-supported platform to provide users with exercise, the exercise, nutrition, stress, and sleep help they need to live their best lives. Joining us is going to be Dr. Wesley Smith. He's the Chief Product Development Officer for StrongPath. Dr. Smith is also the Director of University of Miami's Exercise Physiology Department and the Director of the Graduate Program in Clinical and Applied Nutrition. He specializes in, amongst other things, the protective effects of exercise and nutrition on heart health and also age-related sarcopenia. Before we start, I'm just going to give you a quick overview of how this is going to go. It'll be Dr. Smith talking for about 20 to 25 minutes, and then I'll open it up to questions we can ask him. If you have any questions, there is a spot at the bottom of your screen, the Q&A. You can click on that and type in anything you have questions for. Okay, so with that, Dr. Smith, whenever you're ready.
All right, thanks, Rebecca. It's good to be here. Let's go ahead and jump right into it. And from a StrongPath perspective, one of the things I always like to start with is that the way our platform is designed is to help the members and the clients and the patients that we work with achieve their goals, of course, but also to help them figure out which destination on the path they want to reach. So optimal heart health is one of them, which is obviously today's focus. Optimal muscle health and development, preservation of lean mass, et cetera. Body-related metabolic health, so prevention of diabetes and weight loss, and then cognitive health or mental health, what we call the mind destination. And so we set up programs specifically for each one of these destinations, and today's focus is on heart health, and every one of these talks really kind of delves into the different areas. So heart health is obviously the one we're going to speak about. And one of the things that comes up with, first of all, cardiovascular disease and coronary artery disease specifically being the #1 killer of all Americans and all individuals in westernized civilizations. Also, it is the #1 cause of disability. That often gets overlooked because when these coronary arteries here start to no longer deliver sufficient oxygen and nutrients to the muscle of the heart, it significantly weakens a person and makes activities of daily living very, very arduous. So doing things like health coaching remotely as we do, doing assessments and following through and working with patients using technology is beneficial because just to make it to an office visit is very challenging for these patients. Another thing about it is that it's really difficult to separate obesity, especially visceral obesity, and heart disease. It's really one and the same. So instead of saying cardiovascular disease, now a more common phrase is cardiometabolic disease, because the average person in cardiac rehab has a BMI over 30, which places them in the obese category. So then right off the bat, I like to discuss how much this is lifestyle and how much it's attributed to the parents you chose, the genetic element. And let's take a look at the obesity part, the obesity-related disease part. If you have an obese sibling, of course, you'd be expected to have an increased risk. It's about a 42% increased risk of being obese and having obesity-related disease like coronary artery disease if you have a sibling, a brother or sister that has it. But let's say you have an associate. This is a friend that you spend regular time with every day. If you have an associate that's obese, you have a 171% increased risk. So it's data like that that clearly shows the effects of lifestyle, and there's ample amounts of evidence to support it. One of the things that I like to point out is Dr. Caldwell Esselstyn, which was, he was a very well-known cardiovascular surgeon during the Vietnamese War, and he's written books on nutrition. He's a vegan, so he's a little bit, confirmation bias towards vegan. But his talks are really interesting, especially when he talks about where he was able to determine if the soldier was Vietnamese or American upon autopsy just by looking at coronary lesions. So just looking at the inside of the coronary arteries, he could tell if it was a Vietnamese or an American soldier based on the American lifestyle at the time, starting to increase the consumption of processed foods and more conventional animal meats, et cetera. So there's no question lifestyle is a major factor here, and that's what we're going to talk about today, what you can do with your lifestyle to prevent it. So the first thing I like to do is pump the brakes on the science and just kind of present a very basic overview of what coronary artery disease is. And you can see the arteries out here on the outside of the heart. And then we're looking in this video at what the artery should look like inside. So this is the lumen of an arterial vessel that supports and provides the heart muscle with oxygen and nutrients. And the cells that line the heart's wall, the coronary artery wall there should be silky smooth endothelial cells. And they have a really important function, by the way. They release nitric oxide that allows the artery to really dilate, among other things that they do, but they should be nice and silky smooth like that inside. And it's when they develop a lesion behind their wall. So if these cells get damaged by like inflammation, glucose, high blood pressure, oxidative stress, these cells that should be silky smooth become a little rough and they have more permeability. And then things appear behind them. And essentially what happens is like a pimple forms behind them, what we call an atheroma. It becomes an inflamed pocket of pus that can begin to swell, narrow the artery. And if it ruptures, and then platelets go there to try to repair the rupture, it forms a clot that can cut off circulation to the heart muscle. And that's the #1 cause of death in Americans. And the one right that you see in the picture on the right in the heart, that's actually the left anterior descending coronary artery. And that is known as the widowmaker because it gets so commonly blocked and is such a contributor to this pathogenesis of artery disease. So here is a picture that I show in my graduate class. So it's obviously not for a typical webinar, but the reason why I'm showing it is I'm going to try to make this pretty simple and take you through the process, because once we understand the process, we see all of the things that go into a lifestyle strategy to combat heart disease. And it's really effective. I mean, there's no better medicine really at preventing it than lifestyle. So the first thing that you see over here where it says #1 is this is the inner lining of the arterial vessel. And in there's some damage. Again, that damage could be done by, let's say, high blood sugar. Sugar damages the cell's lining, or it could be done due to high blood pressure and shear stress. Inflammatory cells can do it. Inflammation also increases adhesion molecules. It makes the blood vessels stickier, essentially. And then these little yellow balls here, these are what most people refer to as cholesterol. But really, they're not technically cholesterol. What they are carriers of lipid and cholesterol. These are called lipoproteins. And these are the LDLs. And you've probably heard somewhere along the lines that there's good and bad cholesterol, and people are saying the HDLs are good and the LDLs are bad. But a more appropriate way to really discuss lipoproteins is that they're good and bad LDLs. The really small LDLs are the ones that are problematic. We call that dyslipidemia. So if an LDL is just 5% smaller, it's 50% more likely to get caught up back here in the subendothelial space and contribute to this disease. And so then what do the small ones do too? Well, obviously a lot of animal fat in your diet can raise your LDL because you're distributing fat more to the body, and that's what LDLs do. But the small dense LDLs seem to come from just fuel overload on the liver, especially fuels that raise insulin levels like processed carbohydrates, lots of conventional animal meat, which also raises insulin levels, because insulin is the driver of fatty acid synthesis in the liver. And it's like, I have children, so this analogy might make more sense to me, but if you think of using a bubble wand and making bubbles with like bubble stuff, and if you use the wand really slowly and you grow a bubble slowly, the bubble kind of comes out big and fluffy. And if you use the wand really quickly and you move it fast, then the bubbles come out really small. Well, the synthesis of fat in the liver is very similar to that. If you're making fat rapidly, like in the presence of insulin, due to fuel overload and a lot of fructose and alcohol in your diet, the LDLs come out, the ApoB containing particles that become LDLs, the particle number is so high that they usually come out smaller, and they're more likely to get back here in this space. So the small ones are the really dangerous ones. And that's something that we know now is even more important than your total cholesterol level. Once they get back there behind the artery wall, what happens is really interesting. Especially if you lack fat-soluble antioxidants in your diet, like vitamin A and vitamin E, these fats can get oxidized really easily because they're sitting back there behind the endothelial wall. There's some free radical stress that can easily build in, and then they become oxidized LDLs. So now what it basically is behind your artery wall is some rancid fat, little molecules of rancid fat. And when you have something back there that doesn't belong, what system takes care of it? Your immune system does. So that oxidized LDL promotes an inflammatory response where you have these adhesion molecules. So the artery that is supplying your heart with oxygen and nutrients becomes stickier. White blood cells collect back there called monocytes. They blow up in the macrophages, they consume the LDLs, and then they become these foam cells, these big globules of basic inflammation and fat that release more cytokines, make the blood vessel wall stickier. And it's disgusting to describe it this way, but it's the best analogy. It's like a zit behind the artery wall, building, just a pocket of pus, building up and building up. The artery wall is becoming narrower. The ability for the artery to dilate is more difficult. And the reason I'm going into all this is because it's not as simple as just lowering your cholesterol level. I mean, there's a lot of things. So if you consider the inflammation part, you consider obviously the size of the LDLs, you think about high blood pressure, you think about oxidative stress, all of those play a role. And that's why we really think through lifestyle, we can do a lot of things in a multi-tiered approach that complements medicine to prevent the #1 killer. And by the way, the #1 cause of disability in first responders is actually cardiovascular disease as well. I forgot to mention that. So here's an outline of the things I just mentioned. So you think endothelial damage, so you want to lower blood pressure, you want to reduce free radical stress, you want to help control blood sugar, and you want to lower inflammation. The inflammation has arguably the majority of what takes place here. So you could argue that it's cholesterol more, but I would argue that it's inflammation is probably the major driver of what happens with this arterial plaque formation. The fact that the LDLs are smaller and dense, that's a big deal. The reactive oxygen species or oxidative stress, we want to combat that with a high phytochemical-based and antioxidant-driven diet. More inflammation kicks in, like I mentioned, and then ultimately what that does is when that plaque ruptures, and if that plaque ruptures, the inflammation makes the platelets more likely to aggregate and form a thrombus or what's called a clot, and that's ultimately what blocks the delivery of oxygen to the tissue. And then endothelial dysfunction is that when you have this whole process going on inside the endothelial wall, of course, nitric oxide doesn't relax the wall and dilate the artery as well as it should. So you have all those things kind of stacked on top of each other working against the patients. So I heard a talk years ago from a physician on the ABCs of prevention, but from a medical doctor. And, I thought it was brilliant because it did just kind of stack up A, B, C, D, all the way to G, he made it. And it was great. And because this is using pharmacotherapy. So this is not the way we think as exercise physiologists and nutritionists. This is the way medical doctors think, of course. And to combat the inflammation, aspirin. So you see that a tablet of aspirin prescribed every night before bed is a very common procedure for prevention of heart disease in patients. That gets at the inflammation. Blood pressure prescription. So usually an ACE inhibitor, an ARB, maybe a beta blocker, something to lower blood pressure on top of the lowering of the inflammation. The C is for a cholesterol lowering medication. Usually that would be a statin, which they work great at reducing the synthesis of cholesterol. But remember, cholesterol itself is not the issue, it's the lipoprotein. So statins are effective, but cholesterol has a lot of beneficial things in your body too. Cholesterol is used to stabilize your cell membranes and make them stronger. So if you're on a statin, you're more likely to get delayed onset of muscle soreness from a workout. You're more likely to be deficient in vitamin D. You might see testosterone levels or estrogen levels change a little bit, and you're less likely to have CoQ10, which is a powerful antioxidant. So it is with some side effects, of course. The D is don't smoke, and obviously we can't argue with that. The E is exercise, remind the person to exercise, but there's not a lot of emphasis on the type or how to do it. The F has ranged from folic acid to fish oil pills. And then the G is glucose lowering medication, which is usually a drug that targets the liver at reducing the rate at which the liver produces glucose. It's called Metformin. And it usually in people that have cardiometabolic disease, their liver produces 300% more glucose and releases 300% more glucose than the average person. And this medication drives it down by about 1/3. So this is kind of looking at a poly pill and a multi-tiered drug approach. And the way we look at prevention is not to necessarily replace the drugs, but just to complement them with lifestyle. So let's do the same exact thing. And let's look at A for aspirin, in this case, lowering inflammation, but through lifestyle. So since the aspirin is there to lower inflammation, we can do that as well through the increasing a plant-based diet with more Fruits and vegetables, more skin, the better, the less cooked, the better, the more fresh, the better, because there's tons of phytochemicals that are anti-inflammatory, as well as in herbal teas and things. So for example, turmeric is very powerful in its anti-inflammatory effects. I mean, heck, you can argue that aspirin is a phytochemical because it's an extract from white willow bark. So it's a phytochemical. So numerous phytochemicals, onions, garlic are anti-inflammatory. And really all the high polyphenol fruits and vegetables like berries and things are also very anti-inflammatory. So including them in your diet can make a difference. Good omega-3 sources like flaxseed and from plants, and then obviously wild fish, grass-fed meats have omega-3s, and those are powerful, fairly powerful at lowering inflammation. What I think is underappreciated, and maybe the most important one here, is that every time you exercise, even though you're causing your muscle cells that you're using to become more inflamed, systemically, your inflammation goes down dramatically. The muscle during contraction releases what are called myokines, muscle-like hormones that act like aspirin, that lower systemic inflammation significantly. Every single time you do a workout, you're lowering systemic inflammation. And as you reduce the visceral fat that's associated with lack of activity, you automatically lower inflammation. Another thing is that exercise, a lot of people are familiar with cortisone being a drug to treat inflammation, an anti-inflammatory drug. Well, every time you exercise, you release a natural form of cortisol. That is like a catabolic steroid, an anti-inflammatory steroid. But unlike taking the drug, which we know has a lot of side effects, this is within your own homeostatic feedback system. So it's unlikely to throw things off and have the side effects that we see when people are prescribed prednisone or other cortisone-like drugs. So exercise is potently anti-inflammatory. Fasting and weight loss, because of the changes in visceral fat, you reduce the inflamed fat that sits in and around our internal organs. Getting outside and getting adequate sun. Vitamin D helps improve immune surveillance. So it improves the specificity of our immune cells in a way that can lower systemic inflammation. And stress can drive down immune suppression that leads to a reflexive increase in cytokines and inflammation. So stress management is another thing. So all of these things can help with lowering the inflammation aspect of the disease. The B, blood pressure lowering. The really great thing about exercise, it's one of the things that got me into this field is that when I was 9 years old, I had high blood pressure. Never took a medicine for it, but figured out that I had it. And after I played soccer or after I rode my bike, my blood pressure was always lower. And the reality is that you get an acute blood pressure lowering, especially if you're hypertensive. It can be as much as 10, 15 points after an individual workout of even just 20 minutes. And the lowering effect can last up to 23 hours. And it's funny when I talk to doctors about, some of my physician friends about, hey, exercise can lower, is like a class 1 antihypertensive medication. They say, yeah, but the blood pressure goes up the next day. Well, the same thing happens with a drug, right? You take the drug today, but your blood pressure is lower today, but tomorrow you have to take it again. Same thing. You think of exercise as an antihypertensive medication. Stress management, obviously, by lowering the sympathetic nervous system and improving vagal parasympathetic activity that helps with the rest and digest element of your autonomic nervous system and can help combat stress. Getting more sleep, of course, lowers sympathetic activity and that fight or flight element of our nervous system to help combat stress and lower our blood pressure. One of the really interesting things, this is one of my favorite to tell people because it's so easy to do. A lot of people have heard that salt raises their blood pressure. And it's more of the research recently is showing that it's not necessarily just the salt that does it. So like just eating high salt foods don't really do it. It's eating high salt foods and what they do to the osmolality or the particle concentration of your blood. See, if the salt concentration of your blood goes up, an area of your brain called the hypothalamus identifies that and causes you to reclaim more fluid in your kidneys and then leads to a higher increase in blood volume and blood pressure. So what's really cool is that they found recently, there's been some good studies to show that if you consume a really high salt meal, if you also consume a lot of water with that meal, you don't see the hypertensive response. So staying adequately hydrated, especially after eating food that is high in sodium and sugar, that can help attenuate that increase in your blood pressure that you find after eating these unhealthy meals. The omega-3s from flaxseed and fish, I already mentioned the benefit of them in helping improve blood flow and vasodilation. The phytochemicals can lower blood pressure, as I mentioned, not only inflammation, but they also help with improving nitric oxide function, Turmeric is fantastic at improving nitric oxide function and vasodilation, lowering blood pressure. And fasting regimens and weight loss are protective in that they help lower insulin. And insulin, everybody who knows about metabolic disease understands insulin's primary role is to dispose of blood sugar. But another thing insulin does is it dilutes blood sugar because of the sugar stress that occurs in the body. So insulin acts on your kidneys to boost blood volume and increase blood pressure. So by fasting and losing weight, making yourself more insulin sensitive and lowering the insulin levels in your blood, you will see a decrease in blood pressure typically with that every single time. And it's an underappreciated aspect of losing weight and improving your insulin sensitivity. So let's go on to C, cholesterol lowering. And since there's a lot of overlap here, I'm not going to spend as much time. But we know the major issue with the cholesterol is that dyslipidemia that I talked about, the small, dense LDLs. And what we like to recommend are functional foods that can help combat that. One of the things is helping lower the insulin levels once again on the liver and the rate of fatty acid synthesis in the liver, and eating less carbohydrate, refined carbohydrates that are refined and artificially preserved, which the acronym for that is CRAP. So basically eating less crap. By eating less processed foods, high in sugar and sodium, and reducing the osmolality that I mentioned before, and also reducing the overload on the liver, especially fructose and alcohol and how they overload the liver, you'll slow down the rate of fatty acid synthesis and cholesterol levels in the blood. High fiber foods, especially soluble fiber from like flaxseed and nuts, and oats and legumes, can bind to the intestinal cholesterol and reduce the amount that's absorbed. So they have a significant benefit there at cholesterol lowering. The fasting regimens and the insulin I already mentioned, less conventional animal fat. When eating wild and more naturally raised animal meats, so grass-fed meats or what we call pasture-raised meats, they tend to have more what's called stearic acid saturated fat rather than the palmitic acid, which is the common saturated fat that you hear about that contributes to heart disease. Stearic acid doesn't have a negative effect on cholesterol like conventional animal fat does, saturated fat. Excuse me. And there's also zoochemicals that are beneficial like the omega-3s in grass-fed meats. Aerobic conditioning raises HDLs, so does weight loss. And there's certain saturated fats and MCTs that have been shown to lower cholesterol. One of them is lauric acid, which is a short-chain saturated fat that's found in coconut oil that's been shown to raise HDL cholesterol and lower LDL. So those are all things. And on the right here, you see in addition to providing workouts to the clients, StrongPath also provides functional foods for improvements in health, and then recipes on how to include these foods in your diet so that you can improve things like your cholesterol level. We use the D instead of don't smoke, which is an obvious one, but also the D for decreased body weight. And here's an example of our guide that we provide in the app to clients with sample meal plans and things and ideal shopping lists for ways that you can help lower your body weight. Most of these are going to be aimed at, number one, teaching the body to not just rely, or the central nervous system really, to not just rely on glucose as a fuel, but also to rely on ketones. That's a major factor that help drive down body weight. In addition to that, lowering glycemic index, so things that can lower the rate of blood sugar absorption in the body can lower insulin and therefore lower the rate of fatty acid storage and synthesis in the body. Increasing activity level. And one of the things that's cool about protein, having quality proteins in your diet, is that most people think protein is used for weight gain, but protein causes more satiety and more of a thermic effect than any other macronutrient. So it makes you feel full and it raises your energy levels while digesting protein. So it actually works really well to help with weight loss, raising the protein consumption on a daily basis. And then the functional foods, like I mentioned. The exercise, long, slow distance training, like running, is useful for lowering blood pressure, improving endothelial function, and improving heart health. And also with weight loss from a caloric perspective, because if you've run 6 miles, you'll burn 600 calories, even if you run really slowly. On average, every mile you travel on foot burns about 100 calories. Now, high intensity training doesn't burn as many calories. If you use a Fitbit or an Apple Watch, you'll notice it doesn't burn as many calories, but it works in indirect ways, neuroendocrine ways, at helping with weight loss and heart health. So one of the things that high intensity training does is it increases the number of blood vessels that supply the heart with oxygen and nutrients. So you actually form more blood vessels. So if one of them gets occluded, you have alternative routes for blood to flow. It's like you're doing your own coronary artery bypass, but at a microvessel level. And that's the reason why people that are really active are more likely to survive a heart attack, because they have more coronary vessels and microvessels to supply their heart. And those vessels are larger in terms of their radius. So the high intensity training helps out in that way. And from a weight loss perspective, it has boosts of growth hormone, changes in appetite that are favorable for weight loss instead of just calories. So getting down to the end here on really we got A through G on the ABCs of prevention. But the omega-3 fatty acids, I've talked abundance about them, but ground flaxseed is excellent for prevention of heart disease, because not only is it omega-3 that helps with dilating your arteries and some other stabilizing heart rhythm and some other things have been found for heart disease prevention, but it also is a soluble fiber, which helps lower the cholesterol absorption. And it's anti-inflammatory. And then wild fish, low mercury fish, having the best, most high quality type of omega-3, really essential to have in the cell walls of your endothelium to help with artery dilation and for forming little local hormones that are cardioprotective. So getting a lot of this in is important. And then we have glucose control, and one we have not mentioned yet is gut health. So if you look on the left, we see the app that we use for our assessment. We use what's called HealthSnap for a snapshot of your assessment, our StrongPath coaches do. And we look at all kinds of indices, all kinds of nutrition scores and stuff. We even look at gut health. And one of the key things to improve gut health is increasing what we call vagal tone, which is just getting in better shape. As you become more fit and you see your heart rate get lower, you have more of the parasympathetic nervous system activity throughout your body, which on your pancreas lowers glucose output. A lot of people don't realize that. When you see your heart rate get lower because you're becoming more fit, it's an indication that you have higher vagal tone. And when you have higher vagal tone, it's going to correlate with less blood sugar output because it's going to improve the insulin secretion from the pancreas and then lower the blood sugar from the liver. In addition to that, the vagal tone is very effective in gut health and mobilizing normal intestinal motility. So you also are going to see improved gut function and gut health when you see this too. So a lowering in your heart rate because you're becoming more fit has all kinds of other benefits with it. The soluble fiber from beans can lower blood sugar absorption, not only in the meal where you have the beans, but even in the second meal, like even the next day. It keeps the blood sugar low and protects those arterial vessels, as would intermittent fasting, and then high polyphenol foods for gut health, as well as fermented foods, all shown to increase the diversity of the gut and improve blood glucose control. So overall, that's an overview of the ABCs of a prevention that we like to do in complementary fashion to medical care. And we'd like to do it by our coaches providing an assessment to everyone on the StrongPath. We look at things like cardio score. We'll give you a fitness age. We'll give you a heart age. We'll estimate your VO2 max. We'll look at your fat patterning. We'll give you your suggested caloric intake and a breakdown of your macros and many, many other things. The coach will refer to this on a daily basis and they can track you. And then they'll also provide you with videos, instructional videos on different exercise workouts and even meal plans. If you sign up for the Gold Plan, you get a meal plan and recipes and everything put together as a guide for how you should eat to better improve your path towards your healthy heart destination. Live a longer, more quality life. And I'll finish with this large study out in North Carolina. It's called the Atherosclerosis and Risk and Community Study, the ARIC study, and there's lots of papers that have come out of this. But one of the things they found in this high-risk community of people that have heart disease is that there's 4 things they can do over the course of 4 years to reduce their risk of cardiovascular death by 40%. And that's better than a drug. I mean, that's very powerful. And that was number 1, get their BMI down under 30, so weight loss. Number 2, of course, don't smoke. I didn't even have to mention that much in this lecture because that's just obvious. Smoking increases inflammation in the coronary arteries and makes those adhesion molecules increase and makes the blood vessels stickier. Number 3 is vigorous exercise, where they define as making you sweat for at least 20 minutes every day. And then 5 whole tennis ball size servings of fruits and vegetables. The more fiber, the more fresh, the less cooked, the better. Do those 4 things over the course of 4 years, reduce your risk of cardiovascular death by 40%, which is pretty powerful. So that's a compilation of some complementary things that you can do. to prevent heart disease. These are the kinds of things that we train our coaches on and our exercise physiologists. So thank you for joining me, and I'm happy to take any questions. Sorry, I went a little long there. I don't know if we can hear you, Rebecca. I think
I muted myself. So there's a couple questions. We'll start. So first question is, do you recommend metformin for a non or pre-diabetic person?
Yeah, we don't try to at all change the clinical decisions of the physician. We just like to complement it. And there seems to be a lot of synergy between some of these meds like metformin for lowering blood sugar and the exercise and nutrition changes. The only thing that I would say is there's been a few times, and it's actually good to see, but there's been a few times where we've provided recommendations like this to patients who are getting the traditional smorgasbord of meds like metformin and statins and blood pressure lowering meds. And the patient after a while says he starts feeling bad. I mean, of course, we don't want that. We don't want patients to feel bad. So we're wondering what's going on. Is it the program or what's happening? Well, it turns out that now they're over medicated because now their blood sugar is controlled. Their blood pressure is controlled. Their blood cholesterol is more in optimal alignment in terms of their HDLs usually come up significantly. That a lot of times when the physician finds that out, they actually start removing the meds because they figure out that the patient no longer needs them. So we leave that up to the physician, but I tell you, monitoring the patient remotely really helps make that determination.
Great. All right, the next question, can you please explain how I can use fasting, which you mentioned? I heard about a lot of different fasting periods.
Yeah, so the most popular, probably because it's the easiest to do, is the 16-8 method, where you just find an 8-hour window to consume all of your food. And you try to, of course, keep it in a consistent fashion. There's some, especially from a gut health perspective, some evidence to suggest it has a circadian rhythm to it. So you want to really get into a typical routine. You don't want to vary it from day to day if at all possible. And then think logistically about your lifestyle. Like I like to go out a lot more at night because I work earlier in the morning. So for me, while I'm working, I don't have to think about food as much. But at night, for me, not to with my friends, order that occasional dessert after a meal or whatever, I know I'm not going to be able to do that. So my 8-hour window is 2 p.m. to 10 p.m. And I really have no problem at all. 2 p.m. comes around. In fact, sometimes I forget to eat and I might go as long as 3:30 or 4. So I find it to be after the first 10 days. I usually say it's about anywhere between a week to a month at most, where it takes some getting used to. But during the 16 hours, you can only have water, tea, and coffee, no calories, especially no sugar. And it does take about a week or so to get used to it. But when you do, you find it's incredibly easy. And then what you're doing is training your central nervous system to use ketones as a fuel, metabolites of fat. So your brain isn't using fat for fuel, but it's using metabolites of fat. And now it no longer is going to need to break down muscle. I'm sure a lot of you are aware that you've probably heard that if you skip breakfast or if you don't eat enough, your muscle breaks down and your metabolism gets lower. And that's true if you're not ketone adapted. But fasting helps your brain get ketone adapted, which means when you have low glucose, you don't have to rely as much on breaking down muscle. In fact, you'll preserve your muscle and you'll start using fat. The other method is just a 2-5 method, which is 2 days of the week. You fast for the entire day. And it's not as hard as it sounds. It's if you go, and let's say you finish on Wednesday night dinner at 8 p.m. Well, that means you won't consume your next dinner until the next day at 8 p.m. So it's just a full 1 day period. And then you would eat normally, relatively normally, and then you come back 3 days later or so and you do it again. And some people use like a Monday and a Thursday as the days that they fast, for example, and it's a 2-5 day method. And at first, a lot of dietitians, a lot of people in my field were against this whole process. We've been telling people that breakfast was the most important meal of the day and you can't skip meals and this and this and this. But then the research just became really, it accumulated rapidly, probably more rapid than anything I've seen in all the years I've been in exercise physiology and nutrition. And it's really hard to argue against now for the metabolic benefits.
Great. So we got 2 more. One's kind of on that. So you talked about turmeric. Do you have a recommendation on how much daily or anything like that?
Yeah, there is a risk of potential kidney stones and then some, everything should be in moderation, of course. So usually it's a small amount of turmeric, a few grams of turmeric, if that. So usually it's a couple, like what is it? I think the total that you can have is maybe a teaspoon. But with, or a teaspoon to half a tablespoon but black pepper increases the absorption. So if combined with black pepper, you need even less of it. And it's just, just keep putting it into your day, having like 1 or 2 glasses of turmeric tea, or having a little bit of turmeric in things like sauce and stuff and foods that you prepare is all you really need to get the benefits. It's really potent stuff. You can see the color of it is so bright and vibrant. And that it shows you the phytochemicals and the density of the phytochemical. So you don't really need a whole lot of it for it to be effective.
Great. Okay, so one more, unless anybody has one last one to throw in there. You talked about atherosclerosis. So is that reversible, or is it just something that we can lower the risk for an event happening?
Yeah, that's a great question. So we could actually reverse the disease, especially if the earlier we get it, the better. For one, HDL, increasing HDL through activity and diet and weight loss. HDL literally goes into the atheroma, into the atherosclerotic lesion, and removes the cholesterol from the actual foam cells. So it actually binds to the foam cells and removes that cholesterol. So it actually gradually decreases the thickness of the plaque. So if you increase your HDL by 1 point, you see about an 8% lowering in your risk of cardiovascular disease or coronary artery, ischemic coronary artery disease. So that means like if you raise it by 4 points, you see about a 32% reduction in risk. So 4 points doesn't seem that big a deal, but then you're talking about 1/3 reduction in risk. So HDL improvement is one big one. The other one is the improved endothelial function, the ability for nitric oxide to function better through the use of nitrate-rich vegetables, which produce their own nitric oxide in your body, and through the antioxidants that preserve and protect the nitric oxide that you're forming in your body naturally. Those work to help the arteries dilate. And when that happens, you have just greater protection overall, because even if you start to form the plaque, you still have better delivery of oxygen and blood flow. And then the third is the collateral circulation. So you could actually protect yourself from the disease by adding additional alternative paths for the blood to travel to the heart. And you can do that through the power of exercise, especially intense exercise. Intense exercise where you're really pushing your myocardium. Think of it as a muscle like any other muscle. You're putting an overload on it to a level that it's never accustomed before, and it has to adapt. And it adapts by increasing the lumen of your arteries. It increases the blood vessels that deliver to the heart muscle. And it's really, exercise is an amazing thing. And it should be thought of clinically rather than just muscle head mentality in the gym. And we're heading there. And that's what StrongPath and LifeScan are kind of doing together, showing that exercise is a powerful medicine.
Awesome. Well, thank you, Dr. Smith. Everybody, if you'll look in the chat, there is a link for StrongPath. If anything you've heard today is of interest and you want to kind of get started on that. There's no more questions. So just kind of wrap up there. I'm glad everybody could come today.
Thanks a lot. I appreciate it.